All right, parents, this one's for you. There's a change with school immunization requirements that goes into effect next July. And joining us now to talk more about it is Ronald Balahadia, State Department of Health Immunization Branch Chief. Good morning and welcome.
Good morning, thank you.
Very important to talk about because a lot of people might not know about this, but who will be affected by this? Because it's not just the little ones we're talking about.
Definitely. The rules actually were implemented, and the actual impact is going to be for those that are in preschool, those that are in kindergarten, those that are in 7th grade, and also post-secondary students. In addition, the individuals that are also going to be affected will be those individuals that are new to the school system and would have to make sure that they are up to date with their vaccinations.
So even if they're maybe from the mainland or something like
Exactly.
that? Okay.
So if they come in at 8th grade, they would need to make sure that they're in full compliance with our requirements here in Hawaii.
That covers a lot of students. So why was this change brought about?
So the change was brought about actually because of the fact that our current rules have been in place since 2001, and there have been a lot of changes and updates since then. The Centers for Disease Control and the Advisory Committee on Immunization Practices have been updating our immunization schedule annually. And what has happened is those changes and current medical standards have been updated, but our rules have not. And so there's been discrepancies between the two, and because we follow our laws here, they would need to, the discrepancies oftentimes would have children be vaccinated multiple times when they didn't need it. So this is now in alignment with the current medical standards, and so we're really making sure that all of the requirements are up to par.
And that's good news for parents and kids, too, because if you don't need a vaccination, you don't want to get one, right?
Well, the big thing is that a lot of our children have been actually up to date with their vaccinations because the doctors have been practicing these current medical standards. And so a lot of those kids actually, if they've been vaccinated and been following the schedule, really don't need additional shots because of the fact that they've been up to date with it.
Because as parents, we do need reminders. A lot of reminders, like, did we get this already? Did we not? Do we have to go back to check in?
Exactly.
Can you give me an example of a new requirement?
Sure. So for 7th graders, there are going to be 3 vaccines that we're going to be requiring for entry. It'll be the tetanus, diphtheria, and pertussis vaccine, also known as Tdap. We're also going to be requiring the human papillomavirus or HPV vaccine, and then we're also going to be requiring the meningococcal vaccine, which are normally given at 11 to 12 years of age. So as I said before, if parents are bringing in their kids on the regular schedule, they will have kids vaccinated up to that point in time.
So those are new ones, you're saying?
Those are new ones, yes.
Goes into effect next July.
Exactly, July 1st, 2020.
So again, if you're a parent of a child who's affected, can you go into your doctor and will they look at the grade and say, like, okay, they need these new vaccinations to keep up with state requirements?
Definitely, because that's the current practice right now.
Right.
And so a lot of our physicians are going to be following those practices.
Okay. But if, of course, you need to stay on top of things, you don't want to always rely on your physician, where can parents and even students and teenagers and older kids who would be affected, where can they get more information?
They can go to the Department of Health website, and what we're going to be doing is we're actually launching, and hopefully within the end of the month till next month, a campaign to inform parents, children, also schools, and then also providers to make sure that everyone is up to date with the current requirements and that they are all following it, and that if there are any questions, definitely look at the Department of Health website because that will be the most updated information there.
So there's enough time to get the word out, right?
Definitely, and again, the requirements don't take effect until July 1st, 2020, so we're really trying to get the message out now and prepare everyone for that.
For basically next school year.
Exactly,
right?
the school year 2020-2021.
And I know that the requirements were 18 years old, so there's a chance maybe in the future that it could get changed again.
There definitely could be a possibility, and a lot of that is really to ensure that these diseases really cause impact into our society. As you've heard recently with a measles outbreak occurring in the continental U.S. So those are things that we thought were no longer present, but now are coming back, and there's a possible resurgence with those diseases. And so we want to make sure our kids are protected, and then any vaccines for the future that they can be protected against.
All right, perfect. Thank you so much, Ronald Balahadia from DOH, for joining us. Very important topic, but of course we'll hear more about it in the upcoming year.
Yes, thank you.